Then if we think about the global waves of COVID-19, which recorded in the top of the year, this figure shows the global wave of the COVID-19. And the down it is recorded the Sri Lankan 3 waves of COVID-19 behavior here, health crisis situation. You can see here, Sri Lanka almost going with the globe, I think, with the time lag. We had three waves in our COVID-19 crisis. Now you can see first wave of Sri Lanka started in 27th of January 2020. Then it went into October of the 2020. In the first wave, there was only 13 deaths in Sri Lanka because the Sri Lanka could well manage in the first wave. We completely locked down the economy and we tried to save the people's life at the very beginning. Then the second wave started somewhere around October in 2020. It went into, of course, until the April of 2021. So during that period, 591 people passed away in Sri Lanka due to the COVID-19 health disease. Then, of course, we can see the third wave is now affected. Now we are in middle of, actually tail end of third wave. Third wave that you can see started in after the April. It started in April and it is still continuing and it's now a little bit going down. Altogether now, cumulated value, we have about 10,000, just over 10,000 deaths in Sri Lanka. So this is the direct health impact what we had to face. And meanwhile, the current situation, when we compare the Sri Lankan situation, we have a small issue with respect to the global comparison. Now, in terms of the death rate, that Sri Lanka is slightly above the global average here. And in terms of recovery rate, Sri Lanka is slightly below the global average. So therefore, that the current Sri Lankan COVID-19 crisis is a little bit unexpected one, and we need to come out this COVID-19 health crisis. In that scenario, we have actually made the situation of Sri Lanka, you can understand, by the day before yesterday, when it comes to 7th of September, the total cases, we had 471,000 affected people and 10,500 deaths, and so the death rate was going up by that. So the important hope for Sri Lanka is here. The hope for Sri Lanka is in terms of vaccination. The Sri Lanka started vaccination a little bit after the other countries started. But vaccination process in Sri Lanka, you can see here in the green color, we are nowadays vaccinating very rapid speed Sri Lanka. So therefore, among the Sri Lankans, now 45% of Sri Lankans have, of course, vaccinated. So the hope for the Sri Lanka is to minimize the health crisis is that going into a higher level of vaccination. For that, actually, we have to thank the countries which we are standing with us, of course, Japan, China, and all of the many countries are supporting for Sri Lanka. And so our vaccination process is going ahead. So therefore, I think the Sri Lanka can overcome the crisis soon, the health crisis soon. And even the vaccination, in terms of vaccination, you can see here by the September 17th, Sri Lanka was at a better comparative level with the 43.2% vaccinated by September 7th. So the vaccination in Sri Lanka even comparable with some advanced countries. So there is the hope for coming out of this COVID-19 health crisis. Then after understanding the Sri Lankan situation of health crisis,